Thank you, Chair. I'd like to continue on a little bit what we discussed on Tuesday with the Immigration Minister. So, Ms. Baird, on the Health Canada Interim Federal Health Program website, it outlines who's eligible for coverage under this program. Eligible groups include asylum claimants, detainees who have illegally crossed the border into Canada. On Tuesday, the Minister of Immigration said falsely that once the process is concluded, the coverage ends. I'd like to confirm for the record that the website also includes asylum claimants who are waiting for decisions whether the claim is eligible, and asylum claimants whose claim for refugee protection has been rejected by the IRB. So my first question is, how many asylum claims were rejected in 2024?
I'll take that question. So I'll take that question on behalf of IRCC. And the asylum claims that are rejected or refused, the decision is made by an independent tribunal, as the Minister stated, the IRB. And in fact, the number rejected in 2024 was around 17%, 16-17%.
Okay, so I've got a number of 11,761.
That's right.
Okay, so there is a number. What about 2025? Do you know a number of rejected claims?
2025,
This
as
year.
of June 30, 2025, the IRB rejected 6,947, so
Okay.
it's about 17%.
So of these rejected claims, how many have received health care coverage under the IFHP?
So as the Minister explained, failed claimants also have a right to appeal their decisions. So during the time that they are in Canada, before they are, if they are removed and they failed in their claim for appeal, then they would still be eligible for interim federal health.
Okay, so we don't have a number. Does the Immigration Department or the Health Department track these numbers of bogus claimants that are receiving health care?
Well, we just went through the numbers of rejected claims.
Why does the Immigration Department not track the number of bogus asylum claimants that are receiving health care funded by Canadian tax dollars?
I think we just went through the numbers. I'd already explained that the actual body that makes the decision on whether or not it's a failed claimant is in fact the Immigration and Refugee Board.
Okay. For these people that are coming into Canada on bogus asylum claims, receiving health care funded by Canadian tax dollars, including supplementary care like dental, vision, medical devices, and mental health services that many Canadians don't even receive, do we know how long the coverage lasts if they're rejected?
It lasts until either their status changes and they're covered under provincial health care, or once they depart Canada.
According to a government brief from June 2025, in fiscal year 24-25 alone, you provided healthcare coverage for 623,365 beneficiaries, including 440,000 asylum claimants with expenses of $900 million. Does the department break down the number of people based on the groups listed on the website? For example, how many asylum claimants, how many detainees, how many individuals granted eligibility at the minister's discretion? Is there a breakdown?
Are you asking about eligibility for, I'm not sure how you're using the term eligibility there.
Well, I'm looking for a breakdown. We've got these large numbers. A lot of money is being spent on healthcare. I would like to know how many the minister, at her discretion, allowed this healthcare. I'd like to know how many asylum claimants, how many detainees.
I can tell you of that number, about 440,537 are in fact asylum claimants. However, as you will note, just because you are an asylum claimant, it doesn't mean that there's been a determination of whether or not it is a founded claim. So,
Yeah, I actually said that number, but that's okay. Do you not think it's in Canadians' interest and the best interest of the federal government to know what kind of people are entering into this country and receiving potentially better health care than the Canadians who are funding the program?
I'm not sure I would describe it as better health care.
I sure would. I sure would. When I look at the amount of the billing that doctors are billing to that department at 5 times the rate, they are seeing doctors quicker than average Canadians.
So the IFHP program uses fee schedules and pricing structures that are aligned to provincial and territorial rates.
That's not true. You are
Okay.
being billed at a higher rate from the provinces, and you are just paying it. That you're not following any fee guide.
Well, we do verify for eligibility prior to the payment.
You verify that you're going to pay it, but they can bill whatever they wish, and the rate is 5 times. So the anesthetist, the surgeon are billing you at 5 times the rate that they would normally charge the province that they work in.
I guess I'm not sure what point you're trying to make there.
I'm making a point that we are spending $900 million on health care, and I think that the system is being abused, and I would like to have some accountability. So I'm asking you questions, and you're not really answering them for me, but that's okay. I came across a Federal Immigration Department information sheet, and I'm going to show it to you. Are you familiar with this sheet? I can
No, I'm
pass it
not.
down. You're not familiar with it. It's too bad. This is an up-to-date information sheet, and it would be given to an individual when they come into Canada, but you're not aware of it, so I won't even bring it up. What kind of information do you give to people when they come into Canada to explain our healthcare system? Anything?
Point of order. Point of order. The member had 6 minutes, and we're at well over 7 minutes into his round.
Yes, you're absolutely right. I'm sorry.
Well, I would like a 1-minute warning.
Well, I didn't give you one, and I'm so sorry. That's my fault, but your time is up anyway. Thank you, sir. Bye.
So
Time is up. You know what? You not. I give you a 1-minute warning because I happen to do that as this chair. Many people don't give a warning because you're supposed to be checking your own time yourselves, and I just tell you when your time is up. So that's fine.
Thank you,
okay,
Chair.
let's move on.
Through the chair, according to the Immigration Department, the government is planning to admit 395,000 permanent residents and 650 temporary residents into Canada this year. Is this correct? Yes or no?
Yes, those are the numbers from last year's plan.
So that's over 1 million people. How many of these people are doctors?
I don't have that number, sorry.
Is there any information on that? Do you do an analysis on that?
What I can, I provided some numbers earlier, but so far in 2025, under permanent residents, there have been over 9,000 admitted in healthcare. I'd have to look up exactly what, it depends on what you mean by.
How many were of those, do you have that information of
For
doctors?
doctors, I can tell you that for.
If you could just table that information, the breakdown, that'd be great.
I believe we've already responded to a request that breaks down by family physicians and specialists in surgery and clinical
Can you,
medicine.
have you tabled that? If you haven't tabled to the committee, could you please table that to the committee? Thank you. On October 13th, the Immigration Department made a post on social media to promote Canada's free healthcare system to potential newcomers. It was viewed on Twitter almost 2 million times worldwide. Who approved this post, when 6.5 million Canadians don't have access to a family doctor?
Our communications group in the department, they issue tweets and use other social media to talk about immigration to Canada. Some of the things that they include in that communication would be the situation in Canada, obviously people coming from other countries. There are a lot of things to consider if you're thinking about a big move to another country. So I think it was part of some of those efforts to talk about not only the process in getting here, but what Canada's like, where that information was provided.
Okay. Does the Immigration Department pay for any advertisements promoting our healthcare system to non-Canadians, or in this case, the Communications Department?
Nothing that I'm aware of. I'm not sure I can say that categorically, but nothing I'm aware of that would have been paid advertising.
Could you table that information?
Yep.
How the Communications Department works with healthcare? And is the minister aware of these communications?
I don't know if she would be aware. She would not be aware of some of the day-to-day routine communications that go out from the department.
So, and just so we're clear, what I'm asking to be tabled, if you could table with the committee all advertisements on social media posts relating to promotion of Canada's healthcare system that Immigration Department has published since 2020, including all costs associated with them. Thank you. Did the Immigration Department conduct a specific analysis on Canada's existing healthcare capacity prior to setting immigration levels? Yes or no?
I'm not sure that's a yes or no answer. I can answer it to the best of my ability. We do extensive analysis and consultation. Looking at healthcare capacity was certainly one of the things that we looked at in close collaboration with provinces and territories.
So
1 minute.
If you could table that analysis as well, that'd be appreciated. Is a labor market impact assessment required prior to approving Saudi-funded visa trainees to train in Canadian hospitals?
A labor market impact assessment is not required for visa trainees.
So labor market and the market impact assessment is a check in the system to make sure there's no Canadians available.
For the temporary worker
Yeah.
program,
So it's
yes.
to assess to make sure there's no Canadians available to fill those spots.
Correct.
Okay.
Under the TFW program, there is a labor market assessment test.
Yeah.
We
Okay.
also,
That's good. I have another question.
Thank you. You have 8 seconds.
Okay,
Mr. Major.
how many work permits did the Immigration Department approve last year for Saudi-funded visa trainees to train in Canadian hospitals? And if you don't have that information, please table it.
Thank you. The time is up.
Thank you, Chair. I have a question for the Ms. Baird or Ms. Park. So there's been a lot of defense around the table of Saudis training in our hospitals that need to go home after the training, and that for sure their spots would not be taken if they weren't here, which is very interesting through the chair, because there are thousands of people looking to train in our hospitals that would stay here in Canada. So it's very interesting situation for sure that we're trying to follow up on. One of the things I'd like to know is how many work permits does the Immigration Department plan to approve for Saudi-funded visa trainees this year?
thank you, Madam Chair. I will say that there is no plan or there is no target for the number of visas under this category. The actual visas are issued based on the applications that we received, and the agreements, as I said, are between the medical faculties and the foreign governments, and do not just include Saudi Arabia as well. I will also add that actually this program is not unique to Canada. There are other countries
Okay.
like the U.S.
Thank
and
you.
the U.K.
Thank you.
that have similar programs.
Again, just to follow up on that, how many Saudi-funded visa trainees are here right now? and how many are going to be required to leave?
I don't know how many on hand who are specifically from Saudi Arabia.
Okay, could you find out that information, please, and table it
Sure.
for this committee? Thank you. So another question I have is for the IFHP provided healthcare. Can you please table the numbers broken down by categories of groups that are eligible for this healthcare? And it's the groups are on your website. Let's see, I've got them right here. They are refugee claimants, protected persons in Canada, resettled refugees, victims of family violence, detainees, individuals under specific temporary public policies, and individuals who have been granted eligibility at the minister's discretion. Can you break those down according to category and table that for the committee?
Yes, we can.
Oh, super. Thank you. Okay, so the next question I have is the Institute of Canadian Citizenship and Conference Board of Canada found that new immigrants are leaving Canada at near record rates, with highly educated and highly skilled immigrants leaving Canada at twice the rate of those with less education and lower skills, which is the opposite of what we've been talking about at this table, at this committee, and something we obviously don't want to happen. Can the IRCC table with this committee the information you've collected on the onward migration of medical professionals, specifically the number of permanent residents approved for entry as medical professionals who have come and subsequently left Canada in the last 10 years? Do you have that? Can you table that information?
Certainly check if we have access to that information, and certainly if we have it, we will
Thank you.
provide it.
Thank you. That would be great. Okay, the Federal Skilled Workers
minute.
Express Entry Program is for skilled workers who have foreign work experience and want to become permanent residents of Canada. Is there a specific target number that the IRCC has for how many medical professionals it's seeking to have immigrate to Canada through the Federal Skilled Workers Express Entry Program? Maybe stop the clock.
If you do not have the answer, you could table it, as always, with the clerk to distribute.
Yeah, in front of me, I have the total number under the federal high skilled program in that category, but I don't have the further breakdown.
If you could get that information for the committee, table that. Thank you.
Thank you very much. That time is up now, Ms. Konez. I go to